what can I expect during a treatment? So I'll give you kind of an outline of what a typical corrective chiropractic care program is in our office. We start off with 12-week programs. Why is that? Because that's what the clinical studies show, and you can go look it up in the link below on the CBP nonprofit research publication page, right? So anywhere from 10 to 12 weeks. And most people come in at 3 times a week, and eventually we graduate them down to twice a week. So you're looking at anywhere from 32 to 36 sessions, more or less, in the first 12 weeks, okay? Now, I always start people off with traditional chiropractic adjustments, get their spine moving, get that initial tightness reduced, and also any inflammation and pain at the beginning that they're coming in with. We try to get it reduced as much as possible to get them to tolerate the corrective protocols as soon as possible, okay? So we don't jump into corrective chiropractic care right away. And that can vary from person to person. Maybe the second week they start corrective chiropractic care, the third or fourth week. We always go to the patient's abilities and tolerance, okay? And then once we are done with that initial kind of relief type care the first couple of weeks, we still continue with traditional chiropractic adjustments in my office, and then I start moving people on to corrective chiropractic programs, okay? So we do in-office structural rehab in our office, and I also send home with patients home with traction units, okay? Some of the traction units we use are called Deneral, which are designed to traction the spines and are easy for patients to use at home as well. I have many videos on my channel that show you examples of these, okay? So the in-office patients will do their mirror image exercises depending on the level that we're working on. Sometimes it's more than one level, and then they'll get their chiropractic mirror image adjustments, and then they'll get their mirror image traction setups. We have specific CBP approved traction equipment where we get people to either traction their neck or even full spine setups. We can do them seated, we can do them lying down. So we have a variety of different ways to do that in our office. So they're monitored, they're supervised by me or my staff, and people are also sent home with corrective care exercises, postural exercises, and also traction exercises to be done at home. The beauty of the home traction exercises and programs we give is that in our office, people are coming at 3 times a week, but when they get the home kit, they're now doing something on those off days as well. So now they're getting an intervention of corrective care onto their spine and posture every single day of the week, right? So the more repetition, the better success, okay? So it's kind of an idea of the program. Now, we don't just go ahead and haphazardly treat someone without any follow-up, right? Month 1, I do a follow-up, month 2, I do a follow-up, and then month 3, I do a follow-up. We take posture photos, we do range of motion, different tests along the way, and then on the third one, I do a X-ray evaluation and compare before and after, and want to see what's going on at that point. At that point, someone may need more corrective care, or we just transfer them over to maintenance care if they choose, okay? Maintenance care could be once a week, once every 2 weeks, or once every month, whatever suits the patient's needs. Of course, we give patients functional exercises as well, but we start off with structural exercises first, and then we move into other strengthening exercises further back, like core plank exercises and so forth. So it kind of gives you an idea of a corrective care program in my office, what it entails, okay?